everyone. Welcome back to What's Up Wednesday, or welcome if this is your first time joining us. My name is Rachel, and I'm on the client success team here at Early Learning Ventures. And today I am joined by Brittany and Diane from Colorado School of Public Health to share about the WELL program, which stands for Well-Being of the ECE Workforce in Low-Resourced Locations. Welcome, Diane and Brittany. Thank you so much for joining us today.
Hi.
Thank you. We're excited to be here.
Yeah, I'm excited too. Thank you also to everyone who is watching live with us today, or if you're watching the recorded video later, thank you for being here. If you have not heard of Early Learning Ventures before, we are a 501c3 nonprofit based out of Colorado, and our mission is to expand access to quality and affordable childcare. I have links in the description of this video to take you to our website where you can learn more about our resources offered, as well as access our full What's Up Wednesday playlist. And there's also a link where you can learn more about the WELL program as well. But since we are live today, if you guys have any questions that come up while we're talking, please add them to the chat. We'll try our best to answer them today, or at least point you in the right direction if we're not able to, or we can always follow up later as well. We're also currently hosting a giveaway for a $20 Kroger gift card. And to be entered to win, we're asking that you share some back to school tips and tricks in the comments of our What's Up Wednesday videos. This giveaway is 7 weeks long, so you have lots of chances to enter. You can go back and watch recorded videos, or if you're watching this one live today, add any tips and tricks for back to school, whether that's a tip for a parent or for another provider. Share all of your information there in the comments. It's back to school time, and maybe this $20 Kroger gift card might be able to help. So I'm going to also put these instructions for the giveaway in the comments in Spanish for our Spanish speaking audience. Give me just a second. All right, there we go. Okay, so let's get started. Diane and Brittany, can you start us off by introducing yourselves and telling us a bit about your role at the Colorado School of Public Health?
Sure, sounds great. My name's Diane Brogdon, and I'm the program manager for WELL. So happy to be here with you.
Thank you.
Yeah, and my name's Brittany. I work directly with Diane. My official title is a professional research assistant, but I coordinate with Diane to do data collection as well as the trainings that we facilitate.
Great, thank you both. So can you guys give us an introduction and kind of an overview of today's topic or of the WELL program?
Yeah, absolutely. So WELL stands for the Well-Being of the ECE Workforce in Low-Resourced Locations. And the idea is that our intervention is a multi-level and multi-strategy intervention program. We are housed with the CU Anschutz Medical Campus, so in Aurora, Colorado. And we work directly through the Rocky Mountain Prevention Research Center, which is with the Colorado School of Public Health. And we are really close to the CALP offices. So I believe in a few sessions, you'll have a chance to speak with them too. So they're right next to us, our lovely little neighbors.
Yeah, that's exciting. We were just talking about that. We'll have them on next week.
Sounds great. Thanks, Brittany. And we have a wonderful team of folks who have helped design our program, including our co-principal investigators, Charlotte Farewell and Ginny Puma. And then you see Brittany and myself up there too, as well as Beth and Emily. And then we have a variety of students and other staff members who've worked with us on the project as well.
Great, thank you. What inspired the creation of the WELL program, and what are its main objectives?
Sure. So just to let you know, we're funded by a grant for the administration from Children and Families. And this is the first time that an organization of this size has allotted this much money towards purely staff well-being. The WELL study is centered in community-based participatory research methods. And our co-PIs, Ginny and Charlotte, that I just mentioned, have partnered with large Head Start agencies for nearly 15 years. And here I'll list who we're partnered with right now. And as that is coming up, I'll also say that our previous work was focused purely on physical health of children in Head Start settings, and we kept hearing over and over again from our community partners that the teachers and staff were burned out. So we realized that we wanted to try and shift our focus from children to staff and specifically focus on mental health and well-being. We also read the literature around this to support us that there are specific health disparities that this segment of the workforce faces. So that's what led us to develop first a program called Free that supported educators' mental health and well-being as well as child social emotional development, and then into the Well program after that, which is a multi-level intervention that focuses purely on Head Start staff.
Thank you. Yeah, that's great to see how it's kind of developed. And you said you started with children and moved to staff.
Yeah. And then just to give a little bit more background, we are partnered with 5 other universities throughout the U.S. who also got a grant from the Administration for Children and Families, and we meet regularly with them as well. And then just to let you know about the framework, do you want to move to this slide, or do you have additional questions?
No, go ahead.
Okay, so our primary goal is to support staff well-being, right? And our study design is a step wedge cluster randomized trial with 3 cohorts that's being conducted to evaluate the effectiveness of Well. And we measure teacher well-being by using the NIOSH tool. It's a Healthy Worker Well-being Questionnaire. And it measures work staff well-being in 5 different areas here, including home, community, and society, health status, workplace physical environment and safety climate, workplace policies and culture, and work evaluation and experience. And we used the results from the NIOSH Worker Wellbeing Framework, as well as we added a couple of other validated tools as well to discover what staff needs are around well-being. And then we came up with our 4 main topics that are all centered around social connectedness and personal accomplishment, and they're mindfulness, positive coping, sleep, and psychological capital, which includes psychological capital is just a fancy way of saying hope, self-efficacy, resilience, and optimism. So those are our main topics.
Okay, so surveys have kind of shaped the framework of this program, and you're getting direct feedback from staff and building it around that. That's awesome.
Well, and we do know that the early childhood education workforce, they're responsible, of course, for the learning and development of the youngest and most vulnerable children in our nation. However, working in ECE settings is stressful, and ECE educators often face excessive demands and workplaces that lack sufficient resources to really counteract these demands. So this explains why ECE teachers have higher rates of chronic mental and physical health conditions. For example, rates of depression and anxiety are 2 to 3 times higher than that of the national average. So the poor workforce well-being can lead to higher turnover rates, which then translates to negative teacher-child interactions and delayed developmental outcomes for children in their care. So may I share one more slide that kind of explains that? So the Well program is a multi-level, multi-strategy intervention that aims to promote the well-being of the ECE workforce by teaching staff positive coping strategies, enhancing their social connectedness, and making health-promoting policy, system, and environment changes. And the multi-level where we reach them is at the individual level with a texting platform, professional developments at the interpersonal level. We're really trying to build that sense of social connectedness, that we kind of lost during COVID times, and as well as at the organizational level, we have a wellness team process. So, yeah.
You've got great slides here too. It's nice to see everything, have a visual of how everything is broken up.
Right. It's hard to explain the multi-level piece of it without showing the visual. So thanks so much.
I think what makes the WELL program really interesting and unique is our ability to use the survey from the National BQ and tailor all of the topics. So Diane's done an amazing job of noticing that staff really needed more information and tools around sleep. So we were able to use that to help support some of the topics that we did. And because this is such a new experience for Head Start, it's also one of the very few programs that are focused on staff as opposed to children and families, which is really exciting and needed.
Yeah, and it's great that it doesn't just focus on your role as a teacher. Sleep, that's outside of work. That's encompassing your personal life as well, which we all know does play a huge role in, your work, your everyday life. Yeah, I love that.
And we mentioned before, I know you were talking about surveys. We also have a steering committee that is made up of Head Start agency representatives, and they guiding our study. And we're conducting formative interviews as well to inform program development and to understand the barriers and facilitators to implementing the program. So we're continuing to study, and we do give that staff survey that I mentioned every fall and every spring to staff.
Great. What do you guys have anything to share on what impact you've seen so far throughout the program on staff well-being, turnover rates, and burnout?
Well, we can put the slide back down if you want to. Sorry, so you can see us. Thanks so much. Well, due to the study design, it's a step, like I said before, it's a stepped wedge cluster randomized trial. We'll not be able to analyze the pre-post data to assess the effectiveness of the program until all 3 of our cohorts have completed their implementation year, which will be in year 5, so 2025-26. However, we have feasibility and acceptability data that suggests that the program is highly acceptable, as well as data on our short-term outcomes. I can share a slide on that if you would like.
Yeah.
So as far as attitudes, knowledge, and self-efficacy related to workplace well-being best practices and activities, and goal setting related to well-being constructs targeted by the WELL intervention. I won't read out all of those percentages there, but you can see that our short-term outcomes show that.
Yeah, again, it's great to see a visual.
Yeah, awesome.
So what are some of the key tips for staff well-being that you guys, do you have anything that you can share with our audience today?
Sure. Well, one of the things that we try to talk to staff about is that well-being is a skill that can be learned, and it's multifaceted, and that many of our strategies can be added to the workday. We have an example, a visual of something Brittany developed. I just put that slide up on, it's called chair yoga. Brittany, you want to speak to any of the other sort of tips that we can give that can just fit easily into the day?
Yeah, I think the idea is that we want strategies and things that we can use immediately to take care of ourselves, regardless of whether you're in a classroom or at an office or anything in between. And so we try to develop things that are really hands-on activities that are fun for staff to do, and things that are easily attainable regardless of what environment you're in. So chair yoga is a great example of that. We use this in our mindfulness trainings, and It is exactly like it sounds, yoga where you're sitting in a chair. So we have a few different postures. There's actually so many more, and you can take full 60-minute chair yoga classes if you want to, but these are just a few to kind of get started with. So postures like mountain pose or forward fold, just to get your spine moving, maybe take some of the weight off of your feet if you've been standing all day. And what I love about chair yoga specifically is that you can do it anywhere. I've done chair yoga driving home from work after a long day. You can do it while you're eating dinner with your family. You can do it while, if you're an educator, while you're sitting watching the children play at recess or while they're eating lunch. You can also do it with children. So we really try to make, yeah, exactly. We really try to make activities that are fun for adults and kids so that it's easily accessible for everyone. And it's been pretty successful from what we've tried out. Do you want to add anything, Diane?
Oh, that's great.
This is great. I'm going to come back to this for myself too.
Awesome. Yeah, something new that we've added is also adding in translation to Spanish, which has been really helpful, specifically for the Denver area, and just accessibility.
Yeah, that's great. I appreciate that. So I have the flyer in Spanish as well to share.
Yeah.
So with cohort 3 currently underway and you're entering year 4, what are your plans for ensuring the sustainability of the WELL program after the grant period ends?
Such a great question. Well, in addition to currently teaching positive coping strategies and enhancing social connectedness, each cohort participated in a wellness team process to make health promoting policy, system, and environment changes in the ECE setting that support staff well-being. So we're hopeful that these changes from the wellness team will be sustained. We're, of course, collecting data on whether or not this is happening. And in addition to that, centers will have eventually access to online modules by topic, as well as a sustainability toolkit.
Awesome. I just removed the slides. Or do you have any other slides to share or any final thoughts to leave us with today?
Let me just peek real quick.
I know we covered a lot. I just want to make sure we're not missing everything.
We did. Well, just to let folks know, we're not currently able to add anyone to our study, because we're in year 4 or 5, but we're always actively looking for funding to support new sites. So we'll be back with more information about that if that comes to fruition.
Yeah, we can always do an updated episode, but it's great to hear about the program and that something like this exists. And it's just amazing to learn about and see how you guys are focusing on ensuring staff well-being.
Mm-hmm. Yeah. We're so thankful we get to participate for sure.
Yeah.
Thank you for inviting us to chat about something we care a lot about.
Yes.
Yeah,
thank you
guys so much. I'm going to add the link to the website for the wellbeing program here in the comments. It's also in the description of this video. So I encourage everyone to click that link to learn more. And yeah, thank you guys again. Thank you so much for being here. And thank you everyone for watching.
Take care.
Thank you.
See you next time. Bye.